very good afternoon to you all. So I'm just going to speak to you all a little bit about transforming aging with health innovation, okay? Now, let's start by asking ourselves, how does the world look today? I guess we can summarize it in three ways. We're getting older, the silver tsunami. This is a global trend. We're definitely getting fatter, obesity, diabetes, big problem. And we're getting sicker. So chronic diseases are really engulfing us. If you look at just the number when we talk about aging, 2 billion people are going to be age 60 and above. Not that I'm saying 60 is old. I think in today's day and age, 75, 80 are probably getting to the elderly group. But 2 billion people by 2050. That's only in about 30 years' time. So what we need to do really was very well articulated by our own Singapore Minister of Health, Gan Kim Yong, sometime last year. And he said a paradigm shift is needed in our approach to aging and health. And we've all heard the trends, and this isn't just applicable to Singapore. We've talked about moving from healthcare to health, from hospital to home, and from quality and volume-based to value-based care. And I'll talk a little bit about that shortly. So the question is just to inject a little bit of humor. If we do move from healthcare to health and we prevent all diseases, how are we going to treat that? At this point in time, you've got a rare condition called good health. We have no idea how to treat it. When we talk about healthcare to health, what do we actually mean by this? And I think healthcare to health, is reflected by all these words here, but the one thing that I want to focus on is the prevention. That's what we're really looking at, from moving this shift, okay? And I think the war on diabetes, being the first country in the world to wage a war on diabetes, is a very good example, because you're preventing it, and that's moving from healthcare to health. When we talk about hospital to home, we're really witnessing a global healthcare trend that revolves around patient centricity and empowerment. I said it in my brief few words this morning. Today, the patient is no longer a patient. They are a consumer. We're all consumers, right? We're all dictating where we get care, who we get care by, when we get care. And again, to the extreme of even what care we get. Those are the choices available today. Technology solutions are more often than not the enablers of this shift. And we're going to talk and give you some examples of these health innovations from an aging standpoint. I'm sure all of you have heard of Michael Porter. I think he came to Singapore last year and gave a talk. So I want to just pause for a second, because when we talk about moving from quality and volume-based care to value-based care, a lot of people ask, what does that actually mean? And I think Michael puts it in a very simple way, that a value-based model is one where care is organized into integrated practice units around medical conditions. And what that really means is when you're seeing patients now, it's not on a per fee or per session basis. It's an entire package. What's the outcome? And if you get an overall good outcome, that's what the payments should be pegged to. So how do we transform aging when it comes to health innovation? Before we talk about that, we're just going to share with you what the elderly told us. So in Amsterdam, we have a practice, we have a gentleman who leads that practice who's just been looking at aging for the last 18 or 20 years. And they did a huge survey of thousands of elderly folk across Europe. And what the elderly told us, not surprisingly, was really, they didn't consider themselves as patients and didn't want to be treated as patients. And that ties back in with the whole shift of going from being a patient to now being a consumer, and being very patient-centric and being very empowered. So, however, we should note that reducing the risk to which the elderly are especially vulnerable to is actually helpful in keeping them independent. And we hear the term active aging, and I think that's what we all strive towards, right? We want to age actively. We want to remain independent for as long as we possibly can. So we know older people are more susceptible to infections. We know that they're more likely to fall, and we know that they're more likely to be lonely. Locally, I don't know how many of you here are familiar with the national innovation challenges that we have. Can I get a show of hands? How many of you are familiar with it? Just a couple. Okay, so there's actually a national innovation challenge on active and confident aging. And it really comprises of 3 key research thrusts. The first is to focus and lengthen the health span. Not the lifespan, the health span. Second, they want to be productive longevity. And lastly, they want to have aging in place. So you're looking at research, science, technology to help seniors live independently and have really good lives and a good quality of life. Globally, the WHO did a study of 33 countries. Now, this is some years ago. And they came up with a best practice model for senior living that encompasses 8 key pillars to support active aging. And they are, as you can see here, divided into physical and social infrastructure. Physically, we talk about outdoor space, transportation, housing, communication, and information. From a social standpoint, we're looking at social participation, civic participation and employment, respect and social inclusion, and health and community services. And a lot of senior living facilities, again, I'd say the Dutch are actually leaders in this. We visited them recently. It's amazing some of the simple and complex technological solutions they have in these senior living residences where the people are very independent. And I'll show you a photograph a little later on how independent they can actually be. So I'm just going to give a couple of examples in each of these categories and then kind of summarize it, because the talk is to share some technological innovations that are addressing these. So from being in an outdoor space, obviously, you want to be outdoor, you go for walks in the parks, exercise, etc., etc. But other ways that they're trying to bring them outdoors and using technology are 2 very simple things. Now, I know the picture in the bottom right is not of the aged or elderly, but just to give you an idea. So simple solutions, you have a lot of elderly in Europe who have these bicycling machines that are made so that their posture is upheld and they don't have to hunch over. So then a relaxed position, it's to give them a little bit of aerobic exercise. And you get different techniques. You can cycle and their speed increases and they put a video there. But some of what we saw in Amsterdam is they actually have real video footage. It's like virtual reality of places all over Holland, and the elderly can actually pick where they grew up to reminisce and have old memories. And they can actually cycle through paths and roads. They can row boats. And they see this on video in real life. It's very interesting to get them motivated to exercise. Take a step further with augmented and virtual reality today. You can obviously have masks, but they have found that the elderly, when we talk about those in 70s or 80s, they're not too comfortable with wearing these virtual reality sets. But it does exist. You can pop on a headset, start your exercise, and again, according to where you go in the virtual environment, you actually see what you're doing. So quite interesting. Transportation-wise, not too much to talk about. This was a simple example. You get foldable electrical wheelchairs, so people who have difficulty with mobility can now actually transport it a lot easier, or their carers and caregivers can actually transport it a lot easier. From a housing point of view, this is a huge business globally. Australia has spent a lot of money recently in developing these senior living residences. New Zealand is the same. The demand is so much so that actually in Australia and New Zealand, just an insight to share, they came up with a very interesting model. Their business model for senior living residences and facilities was one where you pay a small amount up front, and they anticipated that the person would just want to be there for 3 or 4 years max. They loved it so much and they remained so independent that the demand completely outweighed the supply, and now they have the problem of trying to get these people out of that living residence. So they're actually building a lot more and trying to change their business models to fund this, because the government has funded it thus far and it's having a lot of impact. In Singapore, we talk about smart homes, and I think Daryl, who spoke earlier, he's been doing a little bit about work in that area of kitting out HDB homes. A lot of people in Singapore are trying to kit out their homes to make it smart home and elderly friendly for when they age. So this is just a very simple illustrative example we came up with. And the point is, you want to cover big things. And we did a survey actually in Singapore asking what are the, priorities if you wanted to retire, and what are you looking at? And no surprise, safety, security, comfort, and connectivity. Connectivity to family, really. So a smart home, technology is amazing. You have now been able to get re-engineered wood or material that is actually flexible. I'm sure you all have seen these, like little gadgets which we play around with when we're kids. And if you're flopping it around, it's all flexible, and suddenly if you pull it, it gets really tight. All of you are familiar with that, right? So you now get flooring that is like that. So when you're walking on the flooring, it's a little bit flexible, but tight enough for you to actually step on. But what happens is, if there's a sudden impact, it's like an airbag. The actual floor is like an airbag and will give a little bit to prevent or try to lower the incidence of hip fractures, which is the most common thing, at least as an orthopedic surgeon, we see in falls of the elderly. You talk about sensors being kitted out, and sensors, we have sensors now today that cover everything. So from your bed when you're sleeping, it actually takes your weight. Just even through your breath, a little bit of weight that you lose. Or if you're dehydrated, your water content, when you wake up in the morning, you can actually track your weight. What does that mean? You can see if an elderly person is dehydrated. And they are very prone to get dehydrated. So these are important parameters to mark out. There are sensors in the toilet that look at the urine, that look at the stool, can tell you if you have blood in them, can tell you if you have proteins in them, can tell you if you have anything you want to look at in them. And this helps preventive care or monitor disease that might be progressing. Everything is connected and wired up today. So someone falls, there's an alarm, an ambulance gets signaled, ambulance comes. This is all the kind of work that is being done in senior living residences to keep people as independent as possible and provide them as best care as possible. Companies like, you heard Snehal, MyDoc, and I must declare I am involved. I've always been giving them advice for the last 4 years, so I must declare my conflict in that way. And WebMD, these are two companies that we're seeing in the region. WebMD is one of the most popular companies being used in Europe and America, in the elderly specifically. MyDoc has started doing health screenings in the elderly in HDB blocks in Singapore, screen more than 10,000 people. A lot of platforms like this are now using virtual health to try to improve care of the elderly. Social participation. You have senior online dating. There was an article I came across a few days ago, too old for Tinder, when I was researching this. I wasn't looking for myself, just to make it clear. Seniors want to date too. There are a multitude of apps available to help them socially participate. Again, one initiative that was started that we saw when we went to Amsterdam, can't remember the company, it was a very difficult Dutch name to pronounce. What they do is they matchmake college students with the elderly, and I'm sure a lot of you have heard this kind of matchmaking, just to keep them company, just to learn from them, hear from their experiences. And it's been really successful because the elderly feel that they're wanted, they share their experiences. The college folk, and these are mainly local, so local Dutch with local elderly Dutch. And they share their experience of when they went to school. The youngsters will tell and educate the elderly of the new technologies coming out there. And so it's a mutual learning, and this has been found to really lower the problems associated with loneliness. And it is well known that social isolation is associated with an increased mortality rate. So you're socially isolated, you are more likely to die. So why not have these kind of apps? Civic participation. It's a company called Speaking Exchange that really helps younger students learn English from older adults. And this is where employment comes into play. So you can actually have these elderly employed. They feel wanted now. They're actually earning some money. Whether they need it or not is a different story. And that kind of makes them very much more enthusiastic, gives them something to do every day. From a respect and social inclusion point of view, these are all those indicators that I talked about from the WHO. So there was an article in 2014 under G Reports entitled A Robotic Companion for the Elderly. So you see here on the top left a picture. There are a multitude of companies now building these kind of robots to keep people company. And they can be in two ways. Some are actually true robots, so chatbots and using AI and to actually communicate with these people. And some are actual real people, just like that. In Ireland, and as far back as actually 2006, 2007, I used to drive a robot from home. He was 5 or she was 5'7", and had my face on it through my laptop at home. And we used to do ward rounds. The kids especially loved it. So this is nothing new, but in the elderly space, it is picking up. A lot of people thought it wouldn't be popular, but in fact, in Europe, it is very popular and has had much success. The bottom right, you see a patient with dementia using a robotic baby seal called Paro. And this seal functions as a pet, for pet therapy. And again, this has been found to be very successful. Local example here, health and community services. In Tan Tock Seng Hospital, they are improving eye care with teleophthalmology. They have clinics and kiosks at the community centers. You know, a lot of us initially thought the elderly wouldn't participate in this. It would be very difficult. In fact, a lot of elderly participate in it because it's a place of social interaction and a great place to receive your care. If you take away those 8 things to kind of summarize it in a more generic fashion, a little bit more specifically into 3, you can really break them down into social connectivity and emotional health, cognitive ability, and physical ability. Physical activity, sorry. So the first, when you talk about enablement of social and emotional needs, which is critical to elderly well-being. Just some simple examples, no reason in particular. So, Internet of Caring Things. How many of you have heard about the Internet of Caring Things? Right. So this was actually, the fact that it grew from was that, I didn't realize this myself, unpaid caregivers form 90% of carers globally. That's a big number. So i.e. it's family members, it's friends, it's volunteer workers who are providing 90% of the care that is needed. So IBM actually, in response to this, pioneered this Internet of Caring Things, which supports these caregivers by developing a network of connected objects and cognitive systems that leverage unstructured data to provide insights for the care that they are providing. So very interesting to use technology. Penrose really delivers 2 services. One is a care check assessment where they look at 150 items across 7 quality of life factors and actually give you a score. Secondly, a safety check. This is more for family members who want to know how safe the environment their mother, father, or elderly family member is living in. And they actually look at the top 100 items that have been validated or proven to actually cause falls. And then you can do the necessary action. SingFit is a very interesting one. It was designed by a music therapist to provide cognitive and physical stimulation in the form of music and singing. And the last one, my favorite, T-Jacket. How many of you have heard of giving a remote hug? I guess back in the day, Facebook, you remember the pokes, right? Remote pokes. But T-Jacket actually gives a remote hug. So you actually wear the jacket, and as a person through the app, you can actually give a hug. So, and you can control the pressure of the hug. So you can let your mom, dad, grandma, granddad know that, hey, we're thinking of you, and give a hug, and the person actually feels it, right? So quite ingenious. Cognitive ability is another key aspect that several innovators are targeting actively. So the 3 simple examples here. Have any of you heard of these apps or platforms? Yeah? Yeah, okay, a few of you. So Senior Brains is a portal that provides puzzles, games, and blogs to engage the elderly, okay? Luminosity is really a brain training app using fun and challenging games. And Duolingo isn't really a brain training app, but it gives games and challenges to help you learn words and phrases of another language. So just to keep the mind active. This is a picture from Singapore. How many of you here read about RoboCoach? No? Just recently announced, right? RoboCoach for elderly workouts in Singapore. It's on Channel News Asia for the full article if you like. So technology we know will enable physical activity and mobility, which are known to prevent functional decline. This is a fact. So RoboCoach, and it's been activated to I think 25 community centers or public settings, is an actual robot that teaches the elderly how to, do physical activities, whether it's dance or move, just some exercise. And that picture is what you see, him or her or it in action. this is what I was coming back to. I wasn't lying when I said this is what we see. So when we went to Amsterdam, there was this, so this isn't a picture of the lady, it's lady herself. I took a picture of the picture. But this is a lady in her early 90s on parallel bars. And they have this picture up in the senior living facility. And they actually have these facilities. So I think the point is, we also have to change our perception. We often think that the elderly are, frail, can't do things. But I remember my boss, actually, one of my bosses in Dublin, he had a consultation with a 90-year-old man who came in to say, my knees are hurting, and he was a farmer. Don't know how many of you have been to Ireland, but the farming population, those who are farmers, are really, rough and tough. They're not necessarily big and huge, but they will, they're very rugged. They want to be in the outdoors. They want to do things. He came in and he had very bad arthritis of his knees, and he needed a knee replacement. We tried conservative treatment. It didn't help. He was literally begging my boss for a knee replacement. But the problem was his 12 family members, and in Ireland families are generally quite big, all came to the clinic and insisted that my boss does not do this operation. And while in Asia we often tend to listen to the family, and that's not right, from a legal standpoint we should still be listening to the patient, but because of cultural differences we often listen to the family. In Ireland, it's the reverse. We follow and listen to the patient, and we actually operated on him. And he went home on day 3, and he, months later, he sends a picture on WhatsApp to my boss of him water skiing, right? At 90 years old. So we need to change our perception that the elderly can't do things. They can be active, till kingdom come. So as a clinician, the message I like to get across is really that I've always believed we should use technology to complement our clinical practices and not replace them. And I think one of the earlier panels, not the last one, but the one before, the last one, sorry, talked about this, that what is the repercussion with all these technology solutions? Are we actually going to lose that touch of medicine? How many of you here are familiar with Abraham Vargas? Yeah, Joanne, you are. Anyone else here familiar with that name? No? So if it's one thing I would love to leave you with is, at the end of the day, sometime today, just Google Abraham, spelt as Abraham, Vargas, which is Verghese, TED Talk. So just, or Abraham Vargas TED. And listen to his talk on the losing the touch of medicine, the human touch. Best talk you'll ever hear. Really fascinating. He's from Stanford. He's a physician author. But I often worry about this as well. It's a true concern, I think, shared by many of my colleagues, that are we losing the healing touch of medicine when we see this technological revolution bringing about this concomitant surge in digital health and what we talk about. So how will healthcare providers today appropriately deliver the care? And what will happen to that relationship between the doctor and the patient? And I kind of divide this into two patient populations. If you think about it, the population that all of us are in, or generation, and maybe one generation less, we're used to the traditional ways of care. But if you look today, you see in a supermarket, a 9-month-old baby I saw, I don't know how it was possible, but they were on an iPad. You look at kids today, very connected to their phones. You look at the streets, kids and people are walking, looking down while crossing the road. So much so that in Europe, they have now developed green man, red man on the floor to address this safety concern, right? So in the future, our patients or consumers may not even want that relationship. And I think that's something a lot of us don't question, and we should. So if the future generations don't want that, this doesn't really become a problem. But until then, my personal opinion is that we need to let technology complement our clinical practices, help us make clinical decisions, improve care, rather than replace us. So I mentioned this term, new health economy, at the beginning, right? So, at PwC, we've defined this new health economy by an ecosystem where new entrants using new business models and new technologies to deliver new ways of care. And often, more often than not, these companies are traditionally non-healthcare players. So like Daryl said, grubby entrepreneur. We have lots of entrepreneurs coming and disrupting the healthcare business with really successful solutions a lot of the time. So when you think about it, these are all kind of things that are important in this new health economy. But coming back to my clinician side, I think patients are still the most important thing. And the people are the most important thing. And to me, my relationship with my patient is a lot more important than the technology that enables me to do things. So when you think about it, technology really is a double-edged sword. And the question is, how are we going to balance this? How are we going to balance the human touch and ensure we still keep safe, quality care in this digital revolution? Coming back to patients, I realized it's actually very simple. If you think about what patience really breaks down into, it comes to the same thing. So I think we just have to be cognizant and say, we can still keep patients at the core, we can still maintain our relationships with them while using technology to complement our practice. Last thing I'm going to show is this photograph. How many of you have seen this photograph? It went viral at the end of last year globally. No? So this was a photograph of a teenager in Canada, and we actually contacted her. Our team managed to contact her to get permission to use this photo, even though it's all over the web. She went for a girls' night out and bumped into this elderly lady in the washroom. And this elderly lady became very nostalgic hearing about this young woman going for a night out with her friends. And so they took these selfie photos that went viral. So I think I'd just like to end by saying, a colleague told me the other day, health innovations in aging should address hardware and not merely hardware. Thanks very much.